The number of people hospitalized with COVID-19 in the Austin metro area was 80 exactly 1 month ago. Now it's 466. As such, the need for convalescent plasma to treat more patients has skyrocketed. KXAN's Eugen Cho checked with doctors to see if there's enough plasma. She also learned what else they're using to help people recover.
Matt Briggs has donated plasma twice already.
Going back for my third next week.
He got sick with COVID-19 back in March after going on a business trip. When he recovered, he found out his plasma with antibodies can help save lives.
She said that there were 3 people that were lined up. I have B-type blood, and there were 3 people that needed my plasma today.
Dr. Jeff Yorio at Ascension Seton says hospitals need more people like Briggs.
Unfortunately, over the last 3 weeks, because of the rapid rise in hospital rates that we've seen, we've gone through our supply fairly quickly.
Doctors tell us plasma is one of the few available treatment options that seem to help patients recover. Dr. Yorio says they're using remdesivir and in some cases prophylactic blood thinners. Or
now with the new data that's come out on steroids, we see a lot of patients that are getting steroids as first-line treatment.
Still, they say plasma plays an important role.
It does seem to be kind of one of the first-line therapies, and we feel that it is more beneficial the earlier it is given in disease.
But its supply is all dependent on donors.
It's worth it to take an hour and a half out of your day and try to save somebody's life potentially.
Eugen Cho, KXAN News.
We Are Blood says it has provided plasma to more than 480 COVID-19 patients in Central Texas, but now requests for plasma have more than doubled. You need to have fully recovered from COVID-19 to donate. We have details on KXAN.com. The Department of State Health Services is distributing a 6th round of the drug remdesivir statewide. After these shipments, the state will have supplied more than 1,400 cases. That's enough for 5,700 patients. The medication is used to treat severe cases of COVID-19. Locally, 78 cases were delivered to hospitals in Travis, Williamson, and Hayes counties. That's enough to treat more than 300 patients.
More than 200 scientists want the World Health Organization to take airborne transmission of the coronavirus more seriously. In an open letter published in the journal Clinical Infectious Diseases, they suggested smaller coronavirus particles in the air are also a problem. Current guidelines state the virus is spreading from large droplets when an infected person coughs, sneezes, or speaks. But these scientists say research shows some of the smaller particles can possibly stay in the air longer and travel greater distances.